Guys, this is Lily and thank you for watching my YouTube channel. So in this video, I'm going to discuss with you the topic about inflammatory arthritis, okay? So inflammatory arthritis is a group of inflammatory diseases affecting connective tissue, including the joints. Okay, so there are conditions considered as inflammatory arthritis, which are the following: the ankylosing spondylitis, the gout, the infectious arthritis, the Lyme disease, the REITER'S syndrome, the rheumatoid arthritis, the scleroderma, the Still's disease, and juvenile rheumatoid arthritis, the systemic lupus erythematosus. Okay? So for the ankylosing spondylitis, it's called AS. Ankylosing means immobility and fixation of a joint, meaning there's several reduction of movement on the joint, okay? And spondylitis means inflammation of the vertebrae. So there's an inflammation on the spine. This condition is always a condition of the spine, okay, or the vertebrae. Now, it is a chronic systemic inflammatory disorder that involves a specific area of the body, primarily the spine. Okay, so that's the vertebrae. It also affects peripheral joints such as knees and finger joints. Peripheral, away from the spine, away from the central nervous system. Okay, and most common in males than females before, but now the frequency is about the same, with men being more severely affected. Okay, so the onset is insidious, usually beginning in early adulthood, with the inflammatory stage of the disease usually ending by age 40. Okay, the development is highly variable, with spontaneous remissions and periods of flare-up, meaning when a disease is active or when symptoms are exacerbated. Okay, so take a look at this guy. This is a picture of the condition ankylosing spondylitis. So you see on the left side, there's the normal spine. So the vertebrae and the disc is thick and it's healthy. And take a look at the picture on the right side. It is the ankylosing spondylitis condition picture. As you can see, the disc is thin and the vertebrae is kind of like crooked, so meaning it's unhealthy and it is fused, or there's a inflammation in this condition. So that is the picture of this condition. Okay, the causes of ankylosing spondylitis, mostly it's idiopathic, which means there's no known cause. Okay, it's also associated with HLA-B27 antigen and may be genetic. All right, so the progression of the disease of ankylosing spondylitis, so it begins with synovitis at the sacroiliac joints, sacroiliitis, so inflammation at the sacroiliac joint or at the region of the sacrum. So sacrum is part of the vertebrae or the spine. And over many years proceeds gradually up to the spine. So from the sacrum, then it proceeds going up to the upper spine, okay, to the thoracic spine, where the rib cage is, where the shoulder vertebrae is, okay. The inflammation at the junctions of ligaments and vertebrae results in fibrosing of the ligaments. Fibrosing is hardening, okay? Bone erosion, and later it's replacement with new bone. So that's what happened. Ankylosing or immobility fixation occurs, well, first at the sacroiliac joints, like I said, then in the ligaments. Ligaments is the tissue that connects bone to bone, okay? Intervertebral foramina at the lumbar. So foramina is like the hole, okay, the opening, and later thoracic spine. So from the lower part of the spine, it goes up to the thoracic spine, the spine at the area of the rib cage or the shoulder area. The progression, if you just take a look at this. Just read on these statements for the prognosis of the ankylosing spondylitis, okay? So there are stages of this condition. The first is the early stages. So the client experiences fatigue, morning stiffness in the lumbar spine, meaning the spine on the lower back, and pain in the buttocks on the buttocks area, low back, and occasionally down the posterior thigh. So the back of like the upper leg, the thigh. Okay, the lumbar lordosis, which is the curve on the lower back. The lumbar spine is lost due to spasm. Spasm, involuntary movement of the the muscles. Flexion, contractures occur in the hips. Okay, so the symptoms are worst after a period of immobility, such as prolonged sitting. So if you're sitting down for a long time, then the symptoms for this gets worse. Okay, so the next stage is the later stage of the ankylosing spondylitis condition. So movement in the spine is severely reduced and muscle wasting due to disuse atrophy may be present. Muscle wasting meaning the muscle becomes weaker. Okay, so less action. Okay, you cannot make use of the muscle for movements because it's really very weak. Okay, so it is atrophied and you cannot use it. With the loss of the lumbar lordosis, meaning the curve in the lumbar area, the thoracic curve becomes more evident. So thoracic curve meaning there's a curve that is getting into formation, like protraction on the rib cage area. Okay, the chest becomes fixed and flattened. So the chest, the ribs on the chest, okay, it becomes flattened, and the thoracic muscles atrophy, meaning the muscles that surrounds the thorax or the rib, the posterior rib, the rib cage, okay, becomes weak as well, or becomes atrophied. Okay, so chest expansion is reduced as a result of costovertebral joint, meaning the ribs and the vertebrae joint involvement. Okay, so it's reduced. So since it is fixed, or it is reduced in mobility, so whenever you're breathing, the chest cannot expand. Okay, so breathing becomes primarily diaphragmatic. Okay, so the person is having a hard time in breathing. Okay, as the disease progresses to the cervical spine is the next spine. Neck movements are lost, so it's hard to turn your neck. Okay, neck movement is reduced as well. Head forward posture develops, so there's like a curve on the neck spine. So the medical treatment for ankylosing spondylitis, okay, it says there's no cure for AS. It is only managed with anti-inflammatories, meaning medications as anti-inflammatory. And spinal deformity is prevented or minimized by regular therapeutic exercises. So therapeutic exercises will minimize the deformity of the spine, such as stretching and diaphragmatic breathing. Okay, deep breathing in and out. Okay, and stretching exercises of the shoulder. Okay, to move the ribs, the rib cage, and the shoulders and the neck. Okay, surgery is rarely used as treatment except with severe hip involvement. Okay, so that's when surgery happen. Participating in home physiotherapy program for AS can have a significant effect in the mobility and function. Okay, so home care physiotherapy program is helpful as well. So the next condition that is part of the inflammatory arthritis is the gout. Okay, this is some kind of popular condition. So it is a group of disorders in which crystals of monosodium urate are deposited in the tissues, accompanied by attacks of acute arthritis, inflammation of the joint. So abrupt inflammation of the joint. So that's what it is. Up to 90% of those affected by gout are men. Again, it's mostly men, usually between the ages of 40 and 50 years. Okay, women who develop gout are usually postmenopausal. Okay, children are rarely affected. Now, the metatarsophalangeal joint. Okay, it's in the feet. Okay, of the big toe, in the area most commonly attacked by gout. So it's the big toe of the foot, and with the tarsal area and ankle also frequently involved. So the ankle and the tarsal area as well. The other joints are less commonly affected. Okay, so here it says an acute attack usually affects a single joint. The initial onset is sudden and extremely painful. So here you go, guys. It may occur at night after a day of more than usual activity. Okay, so the affected joint is obviously red, hot, and swollen. Okay, so read on the few information here, and I'm just gonna continue on. Okay, I have here a few picture of how the joint looks like when a person has gout condition. Okay, so the knees, look at the knees. There's the fingers, mostly the big toe. Okay, it's how, it looks like severe gout. This picture looks like. Okay, so the causes of gout: a malfunction of the normal chemical process that breaks down purines. So that is about gout. These substances, the purines, are found in all the body cells as well as in certain foods such as meat and fish. Okay, either overproduction of the uric acid and under excretion of the uric acid, or in some cases both abnormalities. High level of blood uric acid are termed hyperuricemia. So gout has stages as well. So on the early stage, an acute attack may last for a few days, followed by a symptom-free period of several months or years. Okay, if gout is untreated, attacks are more frequent and severe as the disease progresses. So repeated flare-ups cause joint stiffness, okay, hardening, and reduced range of motion. Immobility, joint movement is reduced, and eventually cartilage and subchondral bone destruction leading to joint deformation. So cartilage, it's the cushion inside the joint. So that it's gonna be it's gonna be affected, and then when it's affected, that's when the deformation of the joint occur. So it's important to treat gout as soon as possible. So there's the chronic stage, which means that it's there for a long time. Okay, the inflammation spreads to other peripheral joints, meaning it's not only on the big toe, but it spreads on the adjoining joints, or more on the knees, or sometimes on the joints of your fingers. Okay, so it's termed chronic tophaceous gout. Occurs on average 10 years, after the initial attack. Okay, so it is marked by subcutaneous deposits of urate crystals called tophi or tophi. These lumps occur outside the joints. So that's the urate crystals deposit outside the joints. So some more information, guys, about gout here. So just read on this or take a look at this. Okay, the medical treatment for gout. So gout is diagnosed through identification of urate crystals in synovial fluid. Okay, the fluid that surrounds the joint, in the joint area. Okay, so it gives the joint this, flow, good flow. Good movement. The inflammation and pain of acute attacks are treated with NSAIDs. okay, and colchicine or sign. These medications, the NSAIDs, okay, non-steroidal medications. All right, so uric acid production is reduced using allopurinol. So that's one medication as well. Some foods, such as liver and sardines, can raise blood levels of uric acid, while alcohol can trigger attacks. Here you go, guys. If you have gout, refrain from drinking alcohol. A person with gout may initially be advised to avoid these substances. Okay? Once medication stabilizes uric acid levels, most people with gout can consume these substances in moderation. Okay, obese people with gout may be placed on a physician-directed weight reduction plan. Okay. Okay, so moving on to the condition infectious arthritis. So it is a joint inflammation resulting from infection by bacteria, viruses, or fungi. Okay, most cases involves one joint, such as the knee, the hip, the shoulder, the elbow, and small joints in the hand or foot. Okay, so 20% of infectious arthritis are polyarticular, affecting more than one joint. So that's only 20%. More common among people with prosthetic joints, immunosuppression, and chronic illnesses. Okay, that's more common. The affected joint is red, hot, and swollen with reduced range of motion. Okay, again, the movement is reduced on this joint due to pain. Okay, during the inflammatory response, fibrin is deposited on the cartilage and synovial lining, so it's inside the joint, leading to ischemia and necrosis. Ischemia, lack of oxygen, necrosis, getting the area is getting a gangrene, like it's gonna be like a dead tissue. If untreated, as the inflammatory resolves, relative capsular fibrosis, hardening of the capsule that surrounds the joint, or reduced flexibility of the joint capsule is present. So there's gonna be eventually a reduction of the movement on the joint that is affected by infectious arthritis. So the causes of this condition may be caused by a number of organisms such as bacteria, viruses, or fungi. Okay, so bacteria will reach the joints both directly and indirectly. So directly as a result of trauma, surgery, and arthrocentesis. Okay, and from nearby abscesses. Okay, and wounds. See, if there's a wound, there are nearby wounds, or you get affected as well, and indirectly through the bloodstream. Okay, through your blood, from other sites of infection such as gastrointestinal tract, okay, through the mouth, esophagus, the stomach, the respiratory system, inhaling, exhaling through your lungs, or the urinary tract, through your from the urine, your organs. Okay, that's gonna be affected as well, where you can get these bacteria, viruses, and fungi. Okay, bacterial causes include Staphylococcus, Streptococcus, Pneumococcus, and tuberculosis infections. Okay, so here it's just it will show you a picture of some the areas of infectious arthritis condition affecting this area. So this is the picture. See how it looks like. There's swelling, redness on the area, and there's like these black spots as well. Okay, so on this information, just take a look at this additional information about the condition. Okay, so arthritic reactions may follow a viral infection. For viruses, viral causes include rubella, hepatitis, for inflammation of the liver, and parvovirus. Okay, joint inflammation usually lasts 1 or 2 weeks and resolves on its own. Okay, fungal arthritis develops very slow over weeks or months. It's the fungi. Okay, pertaining to fungi. The fungi enters the skin through cuts. Okay, fungi that cause arthritis are found in soil and bird droppings. So be careful, guys. Okay, medical treatment for this infectious arthritis. Okay, it is important to treat bacterial arthritis quickly with a full course of antibiotics. All right, with the normal compressive forces at the joint reduce the diffusion and medication from the bloodstream into the joint, perhaps allowing bacteria to remain dormant even in the presence of medication. Okay, medication does not remove the bacterial toxins, okay, in the joint, allowing the possibility of chronic inflammation. So that's not really remove all the bacteria toxins in the joint. That's why the person affected with this condition will have a, an on and off inflammation on the joint. Okay, antifungal medications such as fluconazole are used to treat this arthritis. It's for the fungi, if it's caused by fungi. The next condition is the Lyme disease. It's part of the inflammatory arthritis condition. It is a complex rheumatic disease that affects many systems of the body. Okay, so it's not only one system, but it's many systems of the body. Okay, this illness mimics other diseases, including the flu and several other rheumatic conditions. So it begins after an incubation period of up to 32 days. In 80% of those affected, a large expanding skin rash, erythema migrans, is noticed around the site of the tick bite. So this is about, it's caused by a tick bite. Here you go, guys. This is a picture of a Lyme disease, and it's caused by a tick. So this is a tick on your skin, and that's showing redness all over the affected site. Okay. Okay, to continue, just in some people, the rash is ring-shaped. In others, there is raised vesicular area at the center. The rash is hot to the touch, but not painful. Okay, several days after the onset of erythema migrans, severe headache, fever, chills, stiff neck, swollen lymph nodes, fatigue, muscle ache, and joint pain occur. Okay. Causes of this condition is the Lyme disease is caused by spirochete, Borrelia burgdorferi, which is transmitted to humans by tick bites. Okay, ticks are quite small and hard to observe. An immature tick is about the size of a period. Oh, so small. Okay, ticks live outdoors in wooded or marshy areas and are most active in spring and summer months. They spend part of their life cycle living on birds and other animals such as white-footed mice, then develop to their next stage where they bite humans. Okay, guys, be careful. So manifestations of this condition, so neurological pertaining to nerves, abnormalities developing months after the initial symptoms. Okay, so there is nerve abnormalities, so be careful, including meningitis, okay, inflammation of the meninges, okay, bilateral facial palsy, oh my lord, facial palsy, memory impairment, and distal paresthesia. Okay, so the nerve is affected, all right, your memory is impaired as well. Cardiac involvement can include irregular or slow heartbeat. Okay, so your heartbeat, you can have irregular heartbeat as well, so just be careful. Because the medical treatment for the Lyme disease it is treated with antibiotics as well and is curable if treatment is begun early. Okay, so preventative measures to avoid tick bites include wearing protective clothing that covers the legs and arms. For example, when in the tick area, tucking pant legs into socks prevents ticks climbing onto the skin. After being in wooded areas, people should check the ticks on themselves children and pets. Okay, so just read on the more information, guys, okay, as shown here. Okay, the next condition is the Reiter's syndrome. It is a triad of arthritis, a triad of joint inflammations, okay? Non-gonococcal urethritis and conjunctivitis following inflammation of the intestine or urinary tract, all right? Is only one manifestation of reactive arthritis, an inflammatory joint response to an infection distant to the inflamed joint or joints. Okay, in the inflamed joint, the bacteria that caused the infection are not directly found, but the antigens and RNA from the bacteria are present. Okay, it is 20 times more common in males than females, but it is now believed that the males and female ratio is 5:1. There you go, guys. Okay, you see a picture of Reiter's syndrome here. This is how this disease looks like in your body. Okay, good. Okay, the causes of this condition, the Reiter's syndrome. It is idiopathic. Again, it's no known cause, but it is associated with an initial infection of a genetically susceptible person by Salmonella, Shigella, Campylobacter, or Yersinia bacteria in the gastrointestinal tract, or by Chlamydia trachomatis in the urinary tract. So the bacteria Chlamydia trachomatis in our urinary tract, okay, is the one causing it, and more bacteria on the gastrointestinal tract as well. Okay, there may be a connection to the HLA-B27 antigen in some persons who develop Reiter's syndrome. All right, most cases are seen in adults, are adults after an episode of gastroenteritis, so meaning inflammation of the stomach and the intestine, gastroenteritis. Okay, symptoms of this disease. Early symptoms include joint stiffness, myalgia, meaning pain, muscle pain on the muscles, and low back pain, so pain on your low back. Arthritis develops up to 3 weeks after the initial infection. Typically, joint involvement is asymmetric. Okay, other symptoms, just read on this, guys. Okay, right, cool. There are more symptoms. As you can see, just continue reading, guys. Okay, the medical treatment for this condition. So the Reiter's syndrome is difficult to diagnose, as it says here. Medications such as NSAIDs again and remedial exercises are used to control the arthritis, the joint inflammation, combined with treatment of other presenting symptoms as needed. Okay, it is associated with human immunodeficiency virus, the HIV, the arthritis predating symptoms of IV infection. Okay, so be careful. Certain drugs such as methotrexate used to treat Reiter's syndrome may increase the suppression of the body's immune response, provoking the AIDS symptoms in those with the virus. Okay. The next condition is the rheumatoid arthritis. Sorry of the spelling, the RA. It's an inflammatory, destructive, chronic autoimmune disease on multiple joints and connective tissue throughout the body. Autoimmune disease, guys. The RA is an autoimmune disease, okay? And it affects 1% of the population, with women affected more than men in a ratio of 3:1. So more women than men. Although RA can affect people of all ages, the prevalence increases, which are those between 25 and 50 years are most commonly affected. Okay, it's a systemic disease which have several extra articular symptoms during the flare-ups. Pain, fatigue, low-grade fever, weight loss, and anemia are likely experienced. All right, so rheumatoid nodules present in 25% of those with RA develop where skin and subcutaneous tissues are subject to pressure. The nodules may be permanent, okay, unless surgically removed or may spontaneously resolve. So take a look at this picture, guys, for rheumatoid arthritis. This is how a person with rheumatoid arthritis looks like, the joints, okay? The causes of rheumatoid arthritis is unknown. It is possible that there is more than one cause of the disease in genetically predisposed individuals, okay? A diminished immune response to bacteria and viruses may play a part, okay? If your immune system is reduced, then the likelihood of getting this is higher. The immune system likely plays a role in the disease since rheumatoid factor, an antibody, is present in 70% of those with RA. Okay? Prognosis is uncertain. RA can be mild, attacking a few joints for brief periods. After the first year, in 90% of the cases, or the case studied, joints initially involved are those which are ultimately affected. Okay, in 3% of those with RA, it has an unremitting and progressive course, rapidly leading to severe disability. Okay, so occasionally with severe RA, death results from pulmonary and renal disease. Okay, complications, guys. Symptoms of RA. So the onset of RA is often gradual over several months, with symptom-free periods following for several months or years. There are periods of flare-ups and remission. Okay, there may be complete remission in the first 2 years of the disease. It begins with activation or injury of the synovial microvasculature of the endothelial cells. Okay, so edema or swelling and inflammation result, and the synovial cells multiply and grow. Capillaries proliferate among the newly grown synovial cells within a few weeks. Okay, the affected joints are hot, puffy, and swollen. The skin over the joint is shiny and tight. Okay, guys. Okay, symptoms continue. Just take a look at the information here. Okay, symptoms again are continued here, so just read and take a look at this. Okay, so common joint deformities of this condition. There's the swan neck deformity due to intrinsic hand muscle contracture and proximal interphalangeal joint hyperextended, distal interphalangeal joint flex. Okay, so here you go, guys. Severe loss of function occurs as the person can no longer make a fist. Okay, ulnar deviation may occur with subluxed metacarpophalangeal joints. Okay, disuse atrophy, tenosynovitis, and carpal tunnel syndrome may also be present. Okay, so this will affect the nerves of the hands, can cause carpal tunnel syndrome as well. So boutonniere buttonhole deformity resulting from ruptures of the central slip of the exterior extensor tendons, extensor meaning the posterior forearm tendons, muscle tendons, proximal interphalangeal joint flex, distal interphalangeal joint hyperextended. Interphalangeal meaning the joint in the fingers. There are so many joints here, like between joints. Knee valgus deformity, so the knee, okay, is common. Swelling is pronounced, and the normal contours of the patella disappears. So the patella as well has a deformity. A Baker's cyst, enlargement of the posterior knee bursa, may form in the popliteal space. Okay, in the posterior knee, the popliteal space. Knee flexion contractures may eventually develop if the person is unable to weight-bearing, uses a wheelchair. Okay, guys. Medical treatment. Diagnosis of RA is made with laboratory tests and x-rays and in the presence of the following: morning stiffness for at least 1 hour, involvement of at least 3 joints for 6 weeks, symmetrical joint swelling, and rheumatoid nodule. Nodules are It's like a hardened, tissue. Okay, NSAIDs, so non-steroid steroid medication, methotrexate, an immunosuppressive medication, anti-malarial drugs, penicillamine or gold salts, chrysotherapy. Chrysotherapy may be prescribed. A short course of corticosteroid treatment will dramatically improve the joint symptoms but will not alter the course of the disease. Okay? Severe cases affecting C1 and C2 may require vertebral fusion. C1 and C2. It's the vertebrae, it's the joint or the vertebrae on the neck. Okay? Cervical vertebrae, the neck area. So medical treatment continued for RA. So just read on this or take a look at this. Okay, the next condition or disease is the scleroderma. It is a systemic disorder affecting collagen, okay, characterized by slow spreading fibrosis, hardening, and collagen deposits throughout the body. Okay, it is an autoimmune disorder. It's like the RA, it is an autoimmune disorder. Okay, it's a rare disease usually affecting adults between ages 30 to 50, with women affected more commonly than men in a ratio of up to 5:1. Okay? It varies considerably in its course and outcome from person to person. The survival rate is 10 years. After diagnosis is 65%. Scleroderma. This is a disease affecting the skin. Okay, collagen of the skin. Disability and death are most common early on with the development of diffuse scleroderma, especially for those with pulmonary, cardiac, or renal complication. Renal is kidney complications pertaining to kidney. Okay, so a picture of the disease is this. So take a look at this, guys. So the lips, by the mouth, okay, skin on the arms. That's how it looks like. Okay, causes or symptoms of scleroderma. Again, the cause is unknown or idiopathic, no known cause. However, occupational exposure to vinyl chloride, silica, and organic solvents may be connected to scleroderma-like diseases. Often the first symptom is Raynaud's phenomenon, swelling or puffiness of the digits, and arthritis of the digits. So inflammation on the joints of the fingers, digits. The skin thickens and indurates. So your skin becomes thick. More serious symptoms result from visceral involvement. Okay, that means the inside involves the inside of your body or inside of the skin. Collagen buildup can narrow the esophagus. Okay, esophagus inside the mouth, and small intestine or intestine. So your small intestine, causing reflux. Okay, diarrhea and constipation. All right, congestive heart failure as well, restrictive lung disease as well, malignant hypertension. Okay, so severe hypertension and renal failure may also occur. Renal failure tending to kidney failure may occur. Okay, so there are forms of scleroderma. There's the localized scleroderma. This is a skin disease. Affects the skin, fascia, muscle, and sometimes bone. Okay, so it goes deeper. It strikes children and young adults, mostly females. Fibrotic lesions. Okay, hard lesions composed of abnormal fibroblasts form hard oval patches on the skin's surface. Morphea scleroderma, or extends from the skin deep into muscles and bones of the limbs on forehead, the linear scleroderma. Okay, range of motion is reduced in the affected joints, and collagen deposits in the synovial lining gave rise to joint pain. Okay, on the face, the lips pucker and there is difficulty in opening the mouth, termed mouthcock, mouse-headed appearance. Okay, guys? Okay, so there's another forms or continuing with generalized form of scleroderma. Just take a look at this, guys. Read on the information here. Okay, so the medical treatment for scleroderma, although there is no cure for this condition, certain drugs such as penicillamine or penicillamine may slow its progression. NSAIDs again are also used to treat arthritis, inflammation of the joints, pain. Raynaud's phenomenon is always a disorder on the fingers, the joints of the fingers, treated by keeping the extremities warm. So keeping your limbs, extremities warm. Other symptoms are controlled as they arise. Okay, the next disease under this group of diseases, the Still's disease and juvenile rheumatoid arthritis, still joint inflammation, are conditions of chronic synovial inflammation in the children. Synovial inflammation, inflammation of the synovial fluid or synovial joint of any joint. The causes of these conditions are unknown. Again, it's idiopathic. There's no known cause. The prognosis is for most children with GRA is good, with up to 75% experiencing remission, okay, with little or no residual disability. That's good. Aspirin is the most common medication, okay, so aspirin, guys. Exercises programs are important, as is encouraging the child to lead as normal a life as possible. So a picture of Still's disease. So take a look at this, guys. This is how it looks like on children. Okay. So juvenile rheumatoid arthritis on children. So this is how it looks like too. It affects their joints. This juvenile rheumatoid arthritis may develop at any stage of childhood. Girls are generally more affected than boys. Okay, so more information, just read on this or take a look at this. So the Still's disease is affecting up to 10% of those with juvenile arthritis, has a systemic onset. Symptoms include a high spiking fever, pink rash, hepatosplenomegaly, so the liver and the spleen is enlarged, and anemia, okay? Low or red blood cells, okay? Later, polyarthritis develops. So, like, poly means several or many. Joint inflammation develops. Symptoms usually diminish after 12 months, okay? So adult onsets of Still's disease can affect young adults and both genders. This is polyarthritis, identical to childhood onset Still's disease with additional symptoms, and lymphadenopathy. So the lymph, there's a condition or disease affecting the lymph and the lymph nodes, and less commonly pericarditis. So inflammation of the outer lining of the heart. In some cases, infections and adrenal insufficiency can be fatal. Okay. The last one is the systemic lupus erythematosus, the SLE. Okay, is one type of chronic attack-remitting autoimmune inflammatory disease that can affect any system or organ in a variable manner. Okay, the cause of lupus is unknown. Again, it's idiopathic, no known cause, although there may be a genetic component that is triggered by factors outside and inside the body. Okay, so it says in Canada it affects 15,000 people. People of all ages can be affected. However, women of childbearing age are most at risk. Generally, more women than men get SLE, so more women. SLE is the most common form of lupus. Okay, aggravating factors that can trigger an attack include prolonged and severe stress, medications such as chlorphomazine or SINE, and metaldopa, viral infection, and sun exposure. Certain foods such as plant protein found in soybeans and corn may also act as triggers to attacks. So in this picture, guys, you can see a person with lupus. This is how it looks like. Cause of symptoms. There are variable from it varies from person to person, ranging from mild to severe. There may be periods of remission, exacerbation. So with about the symptoms, just take a look at this or read this. Read all of the symptoms here. Okay. Okay. So medical treatment for SLE. Diagnosis may be difficult. It is made through laboratory tests and observation of symptoms over time. Thorough as SLE has no cure. Many of the symptoms are controllable with anti-inflammatories, and corticosteroids are commonly prescribed. In earlier studies, 50% of patients die within 6 months of diagnosis. Now 95% are functioning 10 years after diagnosis. Okay, so contraindications for inflammatory arthritis. So there are a list of condition or diseases that are part of inflammatory arthritis. So these are the contraindications. So just read on this and take a look at this. Okay. Again, contraindications are continued. Just take a look at this. Just read these informations here. Okay. Okay, so these are the health history questions that a practitioner or a doctor can ask on a client. Okay, how is the client's general health? So this is one question you're gonna consider. What specific inflammatory arthritis does the client have? So we have a list of conditions under this inflammatory arthritis disease. When was the onset? So the beginning of the disease. Is there a history of this arthritis in the client's family? Okay, family history. What is the frequency of acute attacks? So just like abrupt attacks, okay, instant attacks. So what's the frequency? When was the most recent flare up? So the latest, flare up, having these attacks. What are the client's current symptoms? So at this time, you should know the symptoms, the current symptoms of the client as you see the client at the moment. What are the client's activity of daily living? So if you know the clients, what the client does every day. Okay, cooking, exercising, any activity of daily living. Okay, so health history continued. These are other questions that you can ask your client. Just take a look at this. Okay, so for ankylosing spondylitis assessment, so you have all information here. Just take a look at this. Okay, so massage treatments for all of these conditions. So it's written here, so just take a look at this or consider this. Okay, manage massage treatment goals continued on this information, so just read on this. So this Swedish massage is used on some areas, so just read on this. Okay, so self-care for ankylosing spondylitis are all written here, so take a look at this. Okay, so the assessment for the rheumatoid arthritis and other inflammatory arthritis, so are written here. Just take a look at this and read this. Okay, so massage treatment goals for the inflammatory arthritis diseases are written here, so just take a look at this or read this. Okay, all over self-care for a client having any of these inflammatory arthritis diseases or condition, just read on this. Okay, continuing with self-care or other self-care that you can give to your clients are written here. Just consider this and take a look at this. Okay, guys, this video for the inflammatory arthritis conditions, as we know that there are a lot of diseases that is under this condition. So thank you for watching this video. Okay, and please subscribe. I hope this can help you with your studies in your medical studies. And thank you, and I'll see you again on my next video. Have a great day.